CELMoDs are one of the most important or attractive strategies that we will have now as novel agents coming in the scenario. We have been waiting for the result for these agents for a long time, for many years now. And now we have more data with CELMoDs, iberdomide or mezigdomide, in several patient populations and several combinations. Here we are seeing data, for instance, using iberdomide as maintenance, showing that they have a good responses or good results in terms of conversion or response conversion, achievement of CR, achievement of MRD negativity in the EMN26 that was presented by Niels van de Donk. We have good data with the iberdomide as maintenance, we will see, particularly with low doses. Also, we are seeing data of CELMoDs in combination with bispecifics. Also, I think this is interesting to see if we can potentiate the activity of bispecific by using some of these agents that modulate the immune environment. And in fact, we have already seen, or we are seeing a very good data in combination with, for instance, with elranatamab in combination with iberdomide. And we will also have some data with mezigdomide in some of these combinations. So I think it's good because we are now seeing data with these novel these novel agents, the CELMoDs. We are seeing them early in the course of the disease, probably replacing lenalidomide as maintenance, and also as a good partner for combination with the novel agents that we are having now, the novel immunotherapeutic strategies.